Cancer strikes fear in many hearts, and among its various forms, lung cancer stands as one of the most serious medical challenges of our time. Medical statistics show that this disease ranks among the leading causes of cancer-related deaths worldwide, making early detection not just beneficial, but potentially life-saving. Our bodies send us warning signs long before serious complications develop. These physical signals, when noticed and acted upon promptly, can lead to earlier medical intervention and better treatment outcomes. Understanding these warning signs becomes even more pressing when we consider that lung cancer often remains undetected until its advanced stages. The medical community has identified clear patterns and warning signs that can alert us to potential lung problems. These signs range from subtle changes in breathing patterns to more noticeable physical symptoms. By learning about these indicators, you gain the knowledge needed to take action at the first sign of trouble. Think of these warning signs as your body's alarm system. They exist to alert you when something needs attention. Just as you wouldn't ignore a fire alarm, these health signals deserve your immediate attention. The difference between identifying symptoms early or late can dramatically affect treatment success rates. Research shows that people who recognize and report early warning signs have more treatment options available to them. Medical professionals can implement various strategies when cancer is detected in its initial stages, often leading to more manageable treatment plans and better outcomes. This discussion focuses on 10 specific symptoms that medical experts have identified as potential indicators of lung cancer. Each of these signs warrants attention and proper medical evaluation. Some might seem minor at first glance, but when persistent or combined with other symptoms, they become significant markers that shouldn't be dismissed.
By sharing this medical information, we aim to equip you with knowledge that could save lives, whether your own or those of people you care about. Remember, this information doesn't replace professional medical advice, but serves as a guide to help you recognize when to seek medical attention. A persistent cough ranks among the earliest signs of possible lung cancer and needs attention, particularly when it lingers beyond a few weeks without improvement. This type of cough differs from the common cold or seasonal allergies in both its duration and characteristics. Medical observations show that this cough might present itself in different ways. Some patients experience a dry, irritating cough that produces no mucus, while others might notice thick secretions. In some cases, people report seeing traces of blood in their cough, which requires immediate medical assessment. The nature of this cough often changes throughout the day. Many patients report that it worsens during certain periods, such as early morning or late at night. The cough might start mild but become more pronounced over time, affecting daily activities and sleep patterns. What sets this type of cough apart is its persistence. Unlike respiratory infections that typically clear within weeks, this cough continues and might even intensify. The absence of other cold or flu symptoms, such as fever or body aches, can serve as a distinguishing factor. Doctors pay close attention to changes in the cough pattern. A cough that starts as dry but becomes productive, or one that causes pain in the chest or throat area, needs medical evaluation. The presence of unusual sounds during coughing, such as wheezing or rattling, may also point to underlying issues. Shortness of breath stands out as a warning sign that demands medical attention. This sensation goes beyond normal breathlessness after physical exertion and manifests as a persistent struggle to get enough air, even during mild activities or rest. People experiencing this symptom often describe it as feeling winded after minimal effort, such as walking short distances or climbing a single flight of stairs. Some notice they need to catch their breath while talking, or find themselves unable to complete sentences without pausing for air. This breathlessness might worsen when lying flat, forcing many to sleep with extra pillows or in a seated position. The onset can be gradual, making it hard to pinpoint exactly when breathing became more difficult. Many people adapt their daily routines, unconsciously limiting their activities to avoid triggering breathlessness. This adaptation might include taking elevators instead of stairs, reducing walking distances, or stopping physical activities they once enjoyed. Medical professionals assess this symptom by examining how it affects different aspects of daily life. They look at factors such as the level of activity that triggers breathlessness, whether the symptom occurs at rest, if the breathing difficulty changes with body position, how long the breathlessness lasts, and what makes it better or worse. Physical discomfort in the chest manifests in many ways among patients. Some describe sharp stabbing sensations, while others report a dull, steady ache that lingers. This pain might worsen during breathing, coughing, or physical movement. The location of chest pain varies. It might concentrate in one spot or spread across the chest area. Some patients notice the pain radiates to their shoulders, back, or arms. The intensity can range from mild to severe, and the duration might span from brief episodes to long-lasting discomfort. Medical examination becomes necessary as chest pain links to numerous health conditions. Doctors must rule out cardiac issues, muscle strains, and other respiratory conditions through proper testing and evaluation. Many patients wait too long before seeking help, mistaking serious chest pain for minor muscle strain or temporary discomfort. The appearance of blood in coughed-up material represents a medical emergency requiring swift action. This symptom ranges from small blood streaks mixed with mucus to larger amounts of bright red blood. Any amount of blood coming up through a cough needs prompt medical care. The color and amount of blood provide doctors with clues about its source and severity. Fresh, bright red blood suggests recent bleeding, while darker blood might point to different issues. Some patients notice blood-tinged mucus in the morning, while others experience sudden episodes during the day. Medical professionals need to pinpoint the exact source of bleeding. Diagnostic tests help determine whether the blood comes from the throat, airways, or deeper in the lungs. Blood tests, imaging studies, and other examinations form part of the complete medical workup needed to find the root cause. Voice changes that last beyond 3 weeks need medical attention. Such changes might manifest as raspiness, a deeper voice tone, or unusual vocal sounds. Many patients first notice these changes during morning hours, with some improvement throughout the day. The vocal alteration stems from pressure on the nerves controlling voice production. Patients might find their voice tiring quickly during conversations, or notice strain when speaking for extended periods. Some report a scratchy sensation or discomfort while talking. Personal experience varies. Some people lose volume in their speech, others find their voice breaking unexpectedly. Phone conversations become challenging as the voice lacks its usual clarity and strength. Family members or friends often notice these vocal changes before the affected person acknowledges them. Medical assessment can determine whether the voice changes stem from temporary irritation or more serious conditions. Simple actions like speaking, singing, or laughing might become challenging tasks that require extra effort. Sudden drops in body weight without dietary changes or increased exercise raise red flags for medical professionals. This weight reduction often occurs alongside decreased appetite or changes in eating habits. The pattern of weight loss might show up in different ways. Clothes becoming loose without trying to lose weight, noticeable changes in face or body shape, scale readings dropping steadily week after week, and loss of muscle mass, along with fat tissue. Some patients report losing their sense of hunger or feeling full after small amounts of food. Others maintain their usual eating habits but still see continuing weight reduction. This type of weight change differs from intentional dieting results or normal weight fluctuations. The speed and amount of weight loss vary among individuals. Medical professionals track these changes through regular weigh-ins and physical examinations to assess the rate and pattern of weight reduction. Physical exhaustion marks another subtle yet telling sign that needs medical attention. This exhaustion surpasses normal tiredness and persists regardless of rest or sleep. Many people describe this sensation as overwhelming weakness that affects their ability to perform regular tasks. The body requires extra energy to fight against developing health issues, leading to persistent tiredness that sleep doesn't remedy. This exhaustion often combines with other symptoms, creating a noticeable decline in daily function and quality of life. People experiencing this type of exhaustion report needing longer recovery periods after minor activities. Tasks that once seemed simple, such as household chores or short walks, become challenging. This change in energy levels often develops gradually, making it difficult for people to recognize its significance. The exhaustion might start with occasional episodes, but can progress to a constant state of weariness that affects work, social activities, and family life. Repeated respiratory infections signal another area of concern. When the body faces frequent bouts of bronchitis, pneumonia, or other respiratory illnesses, it might indicate an underlying condition requiring medical evaluation. These infections tend to last longer than usual or return shortly after treatment ends. The pattern of recurring infections often shows that the body's natural defense system struggles to maintain respiratory health. The presence of these recurring infections creates a cycle that can mask other developing issues. Each infection might bring its own set of symptoms, making it challenging to identify underlying problems. Medical professionals pay particular attention to infections that don't respond to standard treatments or return frequently despite appropriate care. Swelling in certain body areas deserves careful attention, particularly when it appears in the neck or facial regions. This swelling might appear gradually or suddenly, often affecting one side more than the other. The appearance of such swelling indicates possible changes in how fluid moves through the body, or might signal that nearby structures face pressure from unknown sources. This type of swelling differs from normal fluid retention and requires professional evaluation to determine its cause. Changes in finger appearance, particularly the enlargement of fingertips and altered nail shape, represent another significant physical sign. Medical professionals refer to this as digital clubbing, where fingertips take on a wider, rounder appearance, while nails curve more prominently over fingertips. These changes often develop slowly, sometimes going unnoticed until they become pronounced. The presence of such changes in finger shape and nail appearance often relates to how oxygen moves through the body. This finger clubbing might affect some or all fingers, sometimes including toes as well. The changes typically occur symmetrically, affecting both hands similarly. People might notice their rings becoming tight, or observe that their nails look different when viewed from the side. These physical alterations signal that the body faces challenges in maintaining normal oxygen levels in tissues, particularly in the extremities. Each of these symptoms, persistent exhaustion, recurring infections, unusual swelling, and finger changes, adds another piece to the puzzle that medical professionals must solve. While any single symptom might have various causes, the combination of multiple symptoms helps doctors narrow down possible causes and determine appropriate tests and treatments. The presence of any combination of these 10 symptoms warrants prompt medical attention. Early recognition and professional evaluation provide the best opportunity for successful treatment outcomes. Medical science continues to advance, offering more effective treatments and better results when conditions receive early attention and appropriate care.